For me personally, it's been a passion for many reasons. I'll cite that later as well, but also because my mom, she likes to give me a hard time because she wanted me to be in the healthcare space. She wanted me to be a doctor. So because I failed her, then at least when I do talks like this and we work with clients in the healthcare space, at least I can live vicariously through you and tell my mom so she can get a little happy. So even if I can't be you, I can be near you. Focus on the me first, because again, the goal is to make sure you as an individual feel whole at work. You feel authentic. You feel like you're living your purpose and values. At the same time, all the me's in your organization are accountable for what they say they're going to do. Then we extend that to the we, which is your dynamics between your team, different departments, different functions, and then ultimately it's your community, obviously your patients, but everyone in your ecosystem that you touch as an everyday person, as a practitioner, whoever you are in your organization. You can call it whatever you want. It could be happiness, well-being, whatever it is. There's a convergence of us as individuals trying to understand, who am I in all this? What are my priorities? What are my values? What's my sense of purpose? Am I self-aware of what those things are? And so that's why I'm calling this the adaptive age for us as individuals, but also organizations. How can we control and change what we can, but adapt to and embrace the things that we can't control? Happiness is a business model. How can it impact maybe your organization and maybe your life? Why do we do what we do? And so for us as leaders, what's the larger vision and greater purpose in our work that can inspire people to not come to work just because of the paycheck or purpose? And of course, in healthcare, you have such a tremendous opportunity to reignite what purposes mean. Because you already have this great sense of most people that come to this line of work do it because they care. Do it because they want to make people better. Really interesting because they had a culture committee that they just formed before we got there. And they said, you know, can you help us figure it out? Because obviously we know our purpose. Let's keep kids healthy. Why is it that our employees are so unhappy? So we said, all right, like, just for one moment, let's set aside the doctors and nurses. Let's think about who are the most important people in your organization. Let's think about your frontliners. The first point of contact that your customers or your patients actually see and experience are the people at the front desk. What if you were to give them a sense of control and autonomy so that they feel that they own this experience? What if you were to do that and see how you could change like the dynamic of who they are as a person? And a gentleman came up to me after and he was like really excited and he's like, I totally get it. I get it now, I understand. Like, I love going to my doctor's office. And I was like, that's amazing. Like, who loves going to the doctor's office? He's like, tell me more. And he's like, well, last time I went to the receptionist, the same one that I see every time, and she whips out her business card, and on it was her title that said, Director of First Impressions. Yeah, and this is such a simple concept. No money, you know, it's just like really giving her that autonomy and empowerment of, I'm gonna own this job because this is who I am, and this is aligned with my higher purpose. Everyone's got values these days, but what do they actually mean? Like, as an example, I believe Enron's #1 value was integrity. And we all know what happened to that company. So what we say, hey, let's just define things a little better. Take these values like integrity and define behaviors out of them so they're specific, black and white, measurable and accountable. And one of the things that we actually help our clients do is think about your own personal core values. So when you define those and you align them with your company's core values, do they actually align? He comes to one of my talks, sees this, and realizes, you know what? This is what we need to do. We got to focus on culture. Because he noticed he would walk into the hospitals, walk into the locations, and there was just a complete disconnect. And And especially in the healthcare space, I'm trying not to preach to the choir here, because there is so much origins of your original passion, your original purpose, of why we actually started working in this field in the first place. But because of bureaucracy, because of red tape in government, it makes it so hard to have this sense of how can we actually be happy when there's these changes that we need to adapt to on a day-to-day basis.